You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to Supply, Trust, and the Business of Pharmacy, the podcast where we dive into the forces shaping pharmacy today, from the supply chain to strategy and everything in between. Hosted by Andy Crawford, a 25-year pharmacy industry professional and Vice President of Sales and Marketing at KeySource. For the past 19 years, he has worked directly with pharmacies and manufacturers, navigating disruption, driving growth, and building partnerships rooted in trust. This series is about real conversations with industry insiders, pharmacy owners, and leaders who understand what's at stake and where we go from here.
Hey, welcome back to a special series that's been sponsored by KeySource. This is an important series right now. Couldn't ask for a better partner in putting together this content as we are getting ready for the National Association of Chain Drugstores Total Store Expo 2025. If you are going to NACDS TSE, please come see me. I'm going to be at booth 3523. That's 3523. That's the KeySource booth. We're going to be doing all of our press coverage from that booth. We have a link inside the show notes of this podcast. If you want to be part of the show, we welcome you to come in, give us a press quote, share with us what do you think is happening in our industry? What's good? What's bad? What are you excited about? I love talking technology. I love talking about the business and economics of pharmacy and chain pharmacy, and how chain pharmacy is needed now more than ever with the collapse of certain sectors of chain pharmacy and what's happening with the continuation of our pharmacy deserts. It's kind of crazy. On the screen, if you're watching us on YouTube, if you're seeing us on social media, we have a special series. We did this with KeySource. We really want to dig into some of the economics of this. Couldn't have been at a better time just this week. Community pharmacies. This is from Stat News, statnews.com. And the headline is Community Pharmacies are in crisis. 3 things need to change. And this is from Walgreens Chief Pharmacy Officer, who poses a fix to the system that he said broke long ago, by Mr. Rick Gates. So excited that Rick was featured on Stat News and talking about the business of pharmacy. But for today's continued series, we're excited to welcome back my friend, Andy Crawford from KeySource. Andy, it's great to have you back.
Todd, how are you? Great to see you again. Thanks for having me.
Absolutely. So, I mean, glass half full, glass half empty. I'm always a full guy, but I'm also a realist. I know that we're in a bit of a crisis right now. Thousands and thousands of pharmacies have been closing over the last 18 months. It's accelerated over the last 12 months. We know the reason, the economics behind it. But what I'm excited about is people like you and I, other organizations, NACDS, goodness gracious, what an incredible strength of our entire profession of chain pharmacy as well. None of us are sitting on the sidelines. We're in it. We're not afraid. We're aggressive. We're coming up with some creativity. I really liked the KeySource story episode that you helped to put out. Over 500 people have connected with that episode and are listening and are understanding that there are differences out there. Let's talk strategy. Let's talk about chain pharmacy strategy as we lead into the Total Store Expo. Give us a short overview of kind of some of your positioning, some of your thoughts.
Sure. Well, you called out the elephant in the room, pharmacy and regional and national chains. Obviously, there's been a significant contraction in the national chain space. Anybody that's turned their computer on and seen the news, you've got, CVS obviously contracting about 8%, Walgreens about 16% of their store footprint. And then obviously the divestiture of, Rite Aid. That was a big one. Hard to believe that Rite Aid had over like 2,500 stores just back in 2018. So, significant change within that space. And I think some opportunity to capitalize maybe on some of those, areas for some of the regional chain players, right? NACDS is a great supporter of those regional chains. KeySource has continued to grow our presence within the regional chain space. And I think one of the interesting things about regional chains is they've got some autonomy to really focus on the things that move the needle and the things that they can control right now in this industry and not what they can't control, which is really leveraging their supplier partners and aligning with supplier partners that really drive value and give them, some sort of autonomy. Historically, a lot of pharmacy chains have been beholden to a PVA, and some of them obviously are understanding that negotiating a PVA that gives them some sorts of flexibility to really leverage their generic procurement in a deflationary generic environment, which is much needed, is vastly important. So, really interesting to kind of see, although, and as you mentioned, you're a glass half full guy. I think I fall into that category as well. Along the many things that pharmacy can't control right now, what they can control is who they align with and how they can buy better.
That opens up opportunity for them to save if they're doing things with a lot of analytics, with study, with predicting what they're going to need over the next 30, 60, 90 days. Talk to us about that kind of strategy, why someone in KeySource's position has really started to grow and see more growth lately because of that kind of strategy. These organizations are run by some extremely intelligent people. They know that they're going to need to do things that didn't work or won't work that worked 5 years ago, or that worked 2 years ago. So now things are changing. So talk to us about those relationships that you're helping to build.
Sure, and I think you kind of hit the nail on the head. Historically, if you even, go back 3 to 5 years, you see a lot of regional chains pretty aligned with the same supplier partners, and not a lot of diversification outside. And I think what's driven them to, consider alternate sources like KeySource is really how, one, supply gaps, that was a big driver. If they can't get what they need from their current supply channels, who can they go to as a trusted source to at least fill that gap? Second, Larry, who can bring them, opportunistic forward purchasing to drive value instantaneously on items that they use? And lastly, how can they help for the long term on primary support? So that's where we've seen real change. And I think maybe a change of ideology within that space from procurement people. And there's procurement professionals that I've worked with that have been in this industry, 25, 30 years, very smart. And they understand that autonomy is really what gives them the ability to drive value for the organization. And I think we'll continue to see more of that as this industry faces a lot of uncontrollable challenges.
Well, one of the challenges is the upcoming season that we're coming into. Back to school is always time to start changing some patterns that we didn't see during the summertime because of vacations, because of a bit lax in schedules. But I always see a difference in my business, in publishing, in content creation, as well as the business of our independent community pharmacies, as well as these regional chains. And that is, there's a vaccine opportunity, there's immunization clinics, there's, education around sexual health, there's education around, rare disease and what products are going to be ancillary to that. Some of this is tied back to burnout and really being exhausted. Our pharmacists are exhausted. Even operators are exhausted because of having to do 10 times the work to put out the same amount of, what patients are needing. And sometimes the prescription volume is shooting through the roof, but they're not making really any money. It's just activity. And so let's talk about buying smarter so that we are making a little bit more profit, and dial into some of the sweet spots that may be uncovered because of the upcoming season. I call it back to school season, but it just seems y'all get busier.
Yeah, no, back to school we call it cold, cough, and flu season coming up, which we all know is a significantly busy time of the year.
Fifth grade petri dishes out there.
Yeah, well, I got 4 kids. I know how that goes. They bring all kinds of stuff back to our house. So, but no, you hit a valid point, and I think one to speak to is, one of the uncontrollable things that a lot of pharmacies are faced with is the constant pressure of PBM reimbursement and lack thereof. I think is the more important part, which drives them to what is the thing that they can do to counteract that, and pushing more volume, script volume out of their store, which leads to, as you mentioned, a lot of burnout, right? Larger corporations, if they can increase their script volume, it helps balance out maybe lack of profitability. But I think what we're here today to talk about is what's the one lever you can pull within your organization that will help bring value, and that's procuring generics strategically from a partner that brings you proactive solutions. And one of the things that we will continue to focus on as an organization is forward opportunistic purchases, aligning manufacturers that are looking and are eager to grow market share of their products and their formulary, maybe through KeySource and not through some of the traditional channels. And that's a very big aspect of our success, is aligning a manufacturer need with a value-driven proposition for a pharmacy chain. We'll continue to capitalize on that. And you pair those things all together and you find real value within forward purchases that could bring anywhere from 20 to 30% savings on products that are purchased in bulk. And the nice thing about our regional chains, those that self-distribute, even those that don't self-distribute, is they have the capability to leverage volume. And a lot of times that gives them the upper hand to be able to procure things at a more aggressive cost point. So, and pair that with, as you mentioned, going into cough, cold, flu season, vaccination season, big uptick in antibiotic dispense, and obviously a lot of other health dispense there as schools start. So just for instance, like the Tamiflu products, we do a lot of volume on the Tamiflu products, both the oral capsules and the suspension, as we get closer into these late fall months and early winter months. So, and continuing on with flu. Vaccinations aren't something that we support a whole lot other than as a supplemental supplier. It's never really been our core business model. If we can help supplement end-of-year flu season with a need or a gap in projected, influenza vaccine, we do so, but more of just a supplemental supplier type of need. But really driving a lot of opportunity with forward proactive purchasing. And I'll say one of the unique things that we've continued to hone in on as an organization is, value is really meaningless if you don't have consistency and access. And with a lot of supplier partners in this business, maybe they can offer a price that saves you 50 cents more per unit, but they're out the next day or they're out the next week. So we really continue to focus on how do we bring value and how we do it consistently. So we have a lot of unique programs for primary support for our regional national chains, where we can virtually segregate inventory and have that inventory protected for that promised chain, which has been really nice. And it's a big aspect of how we do business to bring value.
So my comments about the surge of business that you're experiencing and your growth recently is echoed by your schedule at the NACDS Total Store Expo. I was looking forward to getting some additional time slots with you that are now filled up with client meetings. And you've made comments even on LinkedIn that you're like, hey, everybody, I'm excited to go, but guess what? I don't have any time. So that's wild. That's a good thing and a bad thing. It's a good thing because business is business and it's growing, and it's important to be meeting up with your clients. It's a not so good thing because I want to meet new people, and it's like I don't have time to. And I'm going through the same thing with our schedule. But talk to us about the excitement of getting back to NACDS.
Yeah, and it's a great show. It's funny. I look back maybe a decade ago, and and it was, hey, how do we fill the schedule up? How do we get people to meet with us? Who is KeySource, right? I mean, a lot of people see only the tip of the iceberg success, model, so to speak, and not all the work that's done the last 20 years to lead up to it. But, I think NACDS offers a lot of collaboration. You get to meet with, obviously current customers and prospective customers. And we're very fortunate to have a full schedule this year, both with our exhibit hall and through Meet the Market, and even, obviously our social times, social hours. But NACDS really, I feel like, continues to grow and continues to bring value for supplier partners like us. Obviously, I mentioned in the last episode, efficiency is a big attraction to me by being there and being able to meet with a lot of people. But more than that, everyone gets to share their ideas on how they're navigating this consistent, challenge that we're facing with deflation in the generic market. How do you manage the PBMs and how you're adjudicating scripts at a loss sometimes? How mail order pharmacy might be affecting some of the business within the brick and mortar stores, discount cards, and the list goes on and on. So, it's a great opportunity to discuss, how you can overcome and how you can creatively strategize with people. And I think that's a big aspect of what everybody hopes to achieve by attending NACDS TSA.
What about the competitive factors that, to me, haven't really ever been that big of a deal, but they're still out there, and that is the continuous attempt to grow the online pharmacies that are compliant. They're not doing things. I'm not talking about the wild west of the non-compliant online pharmacies. I'm talking about the guys who are doing it the right way, even something like Amazon. But what impact has that had on the regional chains who are more in value of a face-to-face interaction with their clients and slowing things down a little bit, maybe doing a couple health checks? And where's the balance between convenience and better healthcare?
That's $1 million question. I think, we're an inpatient, consumer-driven society. And I call it, for lack of better words, the Amazon effect, right? I'm not saying that's a negative thing, but always tell, my staff is like, when you go on Amazon and you order something and you click order, does it matter what happens in between the time you click order, the distribution, the picking of the product and getting it to your door? And the answer is no. It's, the culture mindset of a consumer is, I want it and I want it as fast as possible. And I'm not saying that pharmaceuticals are geared towards, I want it tomorrow, but convenience is an aspect of the business. I think we all be remiss to say that, mail order pharmacy does offer convenience to patients. And I think let's talk about what regional chain pharmacies are doing to compete with the 90-day mail order prescriptions from some of those that you mentioned. And I think they're aligning themselves to have a central fill facility. Those that are doing it really right. I know some nice operations up in the Northeast that they are very strategic in how they procure, almost to the sense down to the molecule, as is this product in central fill, or is this product being filled at the store? If it's an acute item, obviously there's a higher probability that it's being filled and dispensed at the store. So Todd's kids got an ear infection, or Todd's kids need some Tamiflu. I got to go get at the store right then and there after I get discharged from the physician. But I think we got to give credit to these regional chains. They know the convenience factor of a 90-day fill. And I think the ones that are doing it right, even though they're running brick and mortar pharmacy and maybe they lose some traffic for those 90-day script fills, they're still capturing the business and they're still building that, unique brand of their pharmacy. And maybe it's a mass merchant or a grocer in order to collectively capitalize on a 90-day prescription mailed directly to the patient. So I think your question might orient more towards, how is that affecting those that don't have that capability? And I think the answer is, it is affecting them. I think that, convenience factor within the 90-day script fill, some of the biggest out there, CVS. I know my wife's gotten a prescription before, and it basically said, hey, just want to let you know, and it was a letter that said, hey, we're sending this to our central fill and you're getting it 90-day fills, and this is when you'll receive it. So almost more of a direction more than a choice. But, there's a method to that madness, I assume. So back to the independent pharmacies, they have to differentiate themselves in the smaller regional chains that don't have central fill capabilities, capitalizing on patient services, immunizations. That's the glory of the role of the pharmacist. And I strongly believe in, the ability for them to continue to figure out how they can capitalize on fee for service, which is a big aspect of brick and mortar pharmacy. You want to go in, you want to get a shingles shot or an influenza vaccine. You want to talk to a pharmacist just like you want to talk to a physician, because they have the knowledge and the wherewithal to be able to take care of their patients. And there's a lot of them, although there's a lot of pressure on independent pharmacy and small regional chain, which kind of falls into that category. They're still doing it right. So they just have to figure out where they can control their overhead and what levers they can control in order to remain profitable.
Are you feeling old when you and I used to order from the JCPenney catalog, going to the toy section, and we'd beg our parents to let us order something? We'd order it and we wouldn't see it for 4 weeks, 3 weeks, and we didn't even know when it was coming. There was no such thing as a tracking code or anything, and you're just like, hey, listen. And when it arrives, it's almost like a Christmas day or something. We're so excited. But now I place an order and my new pair of jeans come to my house the next day, sometimes the same day in big cities. And there is a mentality, like when you said that, there is a mentality of our digital age that has been very positive from a convenience perspective, has also been very negative from the humanity perspective, being able to be in front of each other. When I go to a grocery store, which I'm doing less and less because I'm getting my groceries delivered to me.
Likewise.
Another convenience that I don't have to go to I hate going to the store. But when I do go to the store, I notice the interaction is much more transaction driven. It's not as warm as it used to be. I remember, I don't want to sound like an old fogey, but I remember going to Sears or Hills or JCPenney, and the people that worked there knew that they were on a stage and it was up to them to get things sold. So you would get smiles and they want to talk to you, and it was kind of like, and there's an age of our communications that's really disappeared in a lot of ways, especially with the new gen. Just before we started today's session and recording, Andy and I were talking about our children's lingo and in comparison to what we grew up with, Andy. And the reason why I'm mentioning this is that's another reason that I get excited to go to these events and actually see people in person. We're still people that show up at those events, even though they are all getting younger. We're still getting those people who are like, hey, I like doing business face to face. I like being in front of somebody that has an industry reputation, who I've watched online or writing, or you're blogging, or something that you've done, that you've put yourself out there, and there's trust that's built with that. That's one of the reasons that I'm excited that KeySource has been part of this series, is because I wanted to demystify who the heck is this organization, who is this this KeySource, to dig in, because I followed your career for years, Andy, and having that trust behind the algorithm, or behind the strategy, or behind the pricing schedules, or something that you're helping to do, that's a big deal. And I think that that's still, in a digital age, that still means something. So what's the aspect of humanity in this industry from your perspective?
Yeah, I mean, I've been in sales 20 years, been in this industry for about 25. And I got to say, the one thing that never gets old is a solid relationship built mostly in person on trust. I mean, it's very difficult to, especially, let's talk more about, the regional national chains. every relationship I look at that we have today as a result of, an in-person meeting, building trusts. How can I trust you to deliver on and do what you say you're going to do, which is half the battle with finding any supplier partner. And I'm not talking about just, generic RX or brand RX, but, talk about needles or pill bottles or front end store stuff. And it all goes back to, an in-person meeting that, establishes, that core aspect of doing business with somebody that like, and trust. It really is that simple. And I think we talk about the goofy stuff like, JCPenney and Sears Roebuck. And I don't think, even though in a consumer-driven society that is wants things now, wants them fast, I still don't think that's changed the supplier relationship with, a lot of vendors, because that relationship still relies on something that can't be replaced by, AI or even in person or Zoom meetings and team meetings. There's a level of disparity between creating a relationship with somebody solely on a Zoom or a Teams meeting. You can't engage like you can when you're in person. And I think that's truly the humanity aspect that will never, I think, go out of style in doing business with people, where you're trying to build a solid foundation of trust. And that's not exclusive to the pharma industry. It's just in general in business. So I think that'll remain. And I think another reason why we talk about NACDS and going to TSE is, what a stage to be able to create relationships and discuss, strategies with people, maybe that aren't even prospective customers. Maybe there's some other aspects of the pharmacy industry that impacts your business. I'm not a PBM, right? I don't know anything about PBMs. I know how they impact our business, right? I don't sell pill bottles, but I could understand if tariffs on plastic from China increased, what could that do to the pharmacy's bottom line and acquiring containers to put the pills in I sell them? So I think, you get a sense of within these human relationships you build, the ecosystem of pharmacy at a trade show where everybody really relies on one another for success. So I think that's an important aspect of never forgetting that.
We're excited to be a part of this. Once again, the press booth is number 3523. This is at the San Diego gathering of the NACDS Total Store Expo, August 23rd through 25th. KeySource is going to be a big player there. Lots of meetings, lots of activity. But come see us, meet us, meet Andy, meet myself. If you haven't done a podcast, I can't tell you how many people in the pharmacy industry, their first podcast has been through the PPN. And I just want to, I like to meet people and I like to learn from people, because I think that there's just not enough intermixing, because there's not enough time in our years of how fast the year's gone by. It's already fall 2025. Goodness gracious. I got cheated out of summer with an all rainy June. So I'm trying to squeeze out as much sunshine as possible before we get into the southwestern Pennsylvania grayish overcast that we live in most of the time. But Andy, I'm excited to be a part of the NACDS with KeySource. Is there any suggestions for our listeners? If you've been to San Diego before, is there any place that you think is cool or has good food, or like, what should I be looking out for?
Oh yeah, the Gaslight District's got a lot of great food there. Not too far. I'd recommend, people getting outside and walking around that expo center. It's right on the water. You can walk around and see a lot of boats in the water there. So if you like to exercise or go out for a morning walk, make sure you go and do so. And I know you and I will have a 3-hour time difference, so I can't tell you how much of all extracurriculars I'll be doing, but it'll be a busy show. But I would urge people, as Todd mentioned, that haven't learned more about KeySource or learned more about a Pharmacy Podcast Network, is if you're a vendor partner, not only just a pharmacy that's a customer, but a vendor partner, manufacturer, industry professional, come stop by our booth. Give Todd a press quote. We will be putting out, I think there's a link out. We published some links before about that press coat. We love to hear from you. Like I said, earlier, we all rely on one another to be more successful. And I think we're stronger together as we face the challenges in this industry. So don't hesitate to come by and offer your press quote, and love to see you there. So
we would too. Shout out to all of the pharmacists, pharmacy owners, operators, administrators, people going to NACDS. Meet up with us at the KeySource booth. And in the meantime, take a look at KeySource.com. Once again, that's KeySource.com. Reach out to Andy, ask a lot of questions, learn from each other. Andy, we will be seeing you in San Diego, sir.
All right. Sounds great, Todd. Appreciate you.